glad there's water there. I'm starved.
Get a couple of shots first. They're probably on your own.
Tell them I'm about to start. Good afternoon, and thank you for joining us today. Our health and our access to health professionals is vital to all of us. People in Newfoundland and Labrador, like people everywhere, want to lead healthy, productive lives, knowing that access to appropriate, quality health care is available to them when needed. It seems like everywhere you look, there's a shortage of people to fill jobs. And that issue is particularly prevalent in healthcare systems across the country and indeed globally. We know we have challenges in our healthcare system. Some have been prevalent for some time and require significant change. Some are related to an aging population and how we live, while still others have arisen from the pandemic. We also know that none of us can tackle these challenges on our own. Rather, we need a collaborative approach to finding solutions that benefit all of us. This approach is also very near and dear to our Premier, and I can tell you that the Premier is spearheading the drive towards finding these solutions. Just last week, the Premier and Dr. Pat Parfrey met with Canadian medical students at schools in Dublin, and they needed a bigger room to accommodate the interested students at one of those schools. Our work with Memorial's Faculty of Medicine to create 5 new dedicated seats in the Family Medicine Residency Program for students like them, internationally educated medical students wanting to work in Canada, really caught their attention, and one student has already applied. This is in addition to the 5 undergraduate seats that we've put in place at the School of Medicine. Our government, through Health Accord NL, is taking meaningful action across all of government to improve the social, economic, and environmental factors that impact personal health. This includes providing better, more timely access to care, developing a better coordinated modern healthcare system, as well as addressing the factors that contribute to poor health. We know that some of the solutions can be achieved sooner, some will take months, and others, such as changing personal health outcomes, will take some time to see the greatest results. But there is a solid plan in place and a spirit of collaboration with our stakeholders to reimagine the health system for the betterment of Newfoundlanders and Labradorians. In the meantime, we've been working with the colleges, the NLMA, the health authorities, our unions, and other stakeholders to develop creative, innovative, short-term solutions. Our province's physicians play a vital role in healthcare delivery, and I want to thank each and every one of them for continuing to provide the care to Newfoundlanders and Labradorians. We know the daily challenges that each of you face, and I've been working closely with the NLMA since I became Minister of Health. I am pleased to let all of you know that we've been working collaboratively with the NLMA on a multi-year shared agenda focused on strengthening family medicine, and we will continue this positive dialogue as we finalize the details. We recognize that healthcare professionals face many challenges working in our healthcare system. They've carried the load during the pandemic. They need more health professionals working with them side by side to help ease that load. We are committed to turning the tide, and we are pleased to be working together to develop strategies to help make working conditions the best that they can be to both keep our healthcare workers here, but also attract new workers to fill those gaps. The recruitment and retention of healthcare professionals has been and continues to be a challenge, not just in Newfoundland and Labrador, not just in Canada, but globally. Solving this problem requires collaboration amongst all parties, and we must continue to work together to address the issues. The measures we've implemented, both short-term and long-term, to help alleviate the strains in our healthcare system are just the start. We will continue to be creative. We will continue to develop solutions. Back in July, we worked with the regional health authorities and the Newfoundland and Labrador Medical Association to advance measures to alleviate pressures in rural emergency rooms throughout the province. A number of rural health care sites throughout the province have been experiencing temporary closures. As such, we increased compensation rates for those covering the ERs in smaller rural health centres to help retain existing physicians at these sites, as well as attract other locum physicians during the periods of vacancy. I am pleased to report today that we've seen success within a number of these sites. It is anticipated that these measures will continue to help stabilize services while other longer-term recruitment efforts are being implemented. For example, the emergency room in Bonavista was on diversion for 120 hours in July. There have been no diversions in September. Bayvert Peninsula Health Centre experienced 276 hours of diversion in July. That is down to 47 hours this month. Similarly, Fogo Health Centre went from 163 hours in July to 0 hours in September. These are just a few of the examples of how our efforts have yielded results. While we haven't eliminated diversions in all regions of our province, our efforts are ongoing. The health authorities and government continue to focus on future improvement. We also know that virtual care is an important option to address these challenges, as noted in the Health Accord. My department is working with all stakeholders to understand how this service can be operationalized on a province-wide basis, and a request for proposals has been issued regarding the provision of virtual care for the province. Hand in hand with this new health information system, or hand in hand with virtual care, we will have a new health information system which will help facilitate virtual care and improve access to care. Moving much of health care away from paper processes opens the door to improved information decision making. The current technology is outdated and has made communication between health authorities cumbersome, making this an ideal time to procure a new, modernized system for healthcare. The new health information system will also allow government to engage residents in their own health journey by providing digital access to their healthcare information, as well as enable booking and insights into the referral or test ordering processes. When this new system is in place and we move to one health authority, patients will have more ability to book appointments where there are shorter wait times, improving their healthcare experience. A new integrated health information system will allow for the sharing of critical healthcare information across the province. It also aligns with our commitment to a digital modernization of our healthcare system. We've been focused on the recruitment of healthcare disciplines, and we've introduced incentives such as $150,000 for a physician to open or join a family practice. We've introduced a wage guarantee program for physicians, added bursaries and signing bonuses for a number of health disciplines. We will have more to say about recruitment incentives in the coming days. We committed to a suite of measures to expand the supply of healthcare professionals through the creation of a new collaborative community team clinic process, introduced 2 new programs to support family doctors in the province to help improve access to primary health care. We have introduced a one-year pilot program to help entice retired family physicians to come back to the workforce. We have also introduced incentives for other healthcare professionals, such as registered nurses. We've been working closely with the leadership of NAPE, CUPE, and Allied Health on the retention initiatives for those bargaining units, similar to the incentives offered to registered nurses. We expect to make an announcement on these retention initiatives in the very near future. We truly value our frontline healthcare professionals. We understand the challenges each of these professionals encounter on a daily basis, and I commend them for their dedication, especially during the pandemic, the cyber attack, in addition to their day-to-day challenges. I've had meaningful discussions with the leadership of our healthcare public sector unions on these challenges, and I am committed to continuing these discussions and finding ways to improve the workplace environment for all of our valued frontline workers. As part of our recruitment efforts, we also wanted to ensure newcomers can better navigate and understand processes such as licensure and help them find work in this province. Work continues with the College of Physicians and Surgeons of Newfoundland and Labrador and the College of Registered Nurses of Newfoundland and Labrador in an effort to remove barriers for those who've moved to this province from other parts of Canada or other countries. An example of this can be seen in our recent efforts to facilitate pathways for a number of Ukrainian newcomers who have welcomed this as their new home in recent months. We are committed to supporting Ukrainian healthcare professionals who want to work in Newfoundland and Labrador. One such effort is the Ukrainian Physician Licensure Support Program we launched to assist displaced Ukrainian physicians in obtaining licensure to practice medicine in Newfoundland and Labrador. Eligible Ukrainian physicians can receive up to $10,000 in funding to offset the cost associated with obtaining licensure in this province in exchange for a 2-year return in service. There is also a new simulation site at the Centre for Nursing Studies for an assessment of internationally educated nurses that will be launched in the new year. This provides a more streamlined, efficient, and cost-effective internationally educated nurses assessment process. We have navigators in the system to help newcomers understand the requirements for working in healthcare and help them facilitate those processes. This is but a snapshot of some of the initiatives that we've launched, and we know that these measures take time to show meaningful results. Our recruitment teams throughout our health authorities and in the department are working actively to recruit healthcare professionals to the province, and other recruitment plans are in the works with the Department of IPGS. We've been working with our unions, our colleges on recruitment efforts, and we have added resources to our recruitment offices. My colleague, Minister Byrne, and his department have worked closely with us on a focused recruitment effort that will involve our health authorities and other stakeholders. Minister Byrne will have more to announce on the details of this initiative as they are finalized. Our population, as it ages and our demographic changes, we need to provide the right care for residents in the right place at the right time by the most appropriate provider. To assist in meeting this goal, we issued a request for proposals for the development of a human health resource plan for the province. We've been working with the Workforce Readiness Group of Health Accord NL, and we've created a stakeholder committee to provide input on the submissions that have been received. The successful proponent will be required to conduct extensive engagement with our stakeholders. We've also been working with a number of our healthcare stakeholders to identify opportunities to expand the scope of practice in an effort to improve access to healthcare services to all residents of our province. For example, expanding the services of a pharmacist or a nurse can have significant impact on primary care providers. When an individual with a minor ailment can reach out to their pharmacist registered nurse, LPN. This may help provide timely treatment. Expanding these services also expands access to care, particularly at the community level. Additionally, we have increased the hours of nurse practitioner services available on 811. This has been approved, and the 811 has been in the process of increasing this service, which will reduce wait times for appointments. We also know that access to timely surgery is a priority for residents of the province. In consultation with the NLMA, in an effort to address multiple health system shutdowns resulting from the state of emergency experienced with the January 2020 blizzard, followed by the pandemic and the cyber attack, a task force was established to tackle the current surgical backlog and provide meaningful solutions. The task force will consist of healthcare professionals from across the province. They have been meeting since late June to identify areas of concern and develop potential solutions. Initial recommendations are expected from the task force in November. In a similar vein, we've entered into a Memorandum of Understanding between Eastern Health and the University of Ottawa Heart Institute. This agreement allows for a number of patients deemed suitable from this province to travel to Ottawa for cardiac surgery. To date, approximately 30 eligible patients have gone to Ottawa for cardiac surgeries, and planning is underway to send additional patients. Additionally, approximately 40 cardiac surgeries were also carried out by the Ottawa surgeons here in Newfoundland and Labrador. We also announced that a number of hip and knee replacements would be performed on an outpatient basis, eliminating the need for post-operative hospital stays, as patients would mobilize shortly after surgery and return home the same day. The introduction of same-day joint replacements helps minimize the wait times and improve access to care, as in some cases, lack of available beds for inpatient care has been a barrier to a patient receiving planned surgeries. Renovations and operational planning is underway to open the new same-day joint replacement unit in November. Equipment has been ordered, and Eastern Health is also in the process of hiring staff. Orthopedic surgeons have already identified eligible patients. We've also been made aware of the backlog regarding cataract surgeries in the province. Together with the NLMA, we continue to augment the cataract surgery backlog in the province through a program that is jointly administered. We completed a review of the program, and in response to the findings regarding wait lists, we are approving a one-time increase of 3,300 procedures to the regional caps on cataract surgeries in non-hospital facilities. This equates to an additional 1,100 procedures for the second half of this year and 2,200 procedures for 2023-24 fiscal year to reflect both regional demand and the current provincial demand for the service. All non-hospital facilities will be required to prioritize the longest waiting patients with this additional allocation. There will also be a minimum number of these procedures that will be required to be completed within hospital facilities, in addition to those outside the hospital environment. Provincial and regional caps will be reevaluated once again when we move to a single regional health authority, and a provincial central intake process is in place, so that we can ensure that patients can see the next available ophthalmologist anywhere in the province. Despite these investments and our progress, we recognize we must continue to do more. We will continue to look at seat capacity, growing our own, enticing people back to the province, and welcoming health professional newcomers to the province. We will also continue to extend our reach for healthcare professionals nationally and internationally through our recently launched extraordinary everyday recruitment campaign. The campaign demonstrates how every day in this province is an extraordinary day through the use of photography that matches healthcare workplace scenes with amazing landscapes, and lifestyles. There is nowhere in Canada like Newfoundland and Labrador. The people define our province as much as our rugged geography, friendly, welcoming, and positive people culture in the province. In our rural and remote communities, healthcare professionals will gain experience that realizes their career aspirations of making a difference as part of a province-wide team. They will make use of all of their training amid an environment that welcomes them into the community. As I've stated earlier, the challenges in our healthcare system were not created overnight. They cannot be solved overnight, but our focus remains the continuous improvement of a healthcare system in conjunction with our stakeholders that supports our health professions and better health outcomes for the residents of Newfoundlanders and Labradorians. Thank you. We're now open for questions.
Minister, with all due respect, it seems like a lot of what you're announcing today is things that you've done or kind of things that are underway. What are some of the new things today that you want people to be aware of?
There's a number of new things in there. You're correct. A lot of it is what we've announced. Over the last 2 or 3 months, we've been very busy working with stakeholders, working with our unions, our colleges. We've made tremendous progress. We're actually seeing results as we've seen in our Category B sites. Some of the new things, I've hinted at what's to come from Minister Byrne and IPGS on a very dedicated recruitment process. We've hinted that we have other incentives that we're going to be announcing in the near future. We've announced today for the very first time cataract surgery cap increases. We've talked about the joint replacement and the fact that that will be open and available in November. So those are some of the new things that we've talked about. There's a tremendous amount of accomplishment over the last 2 or 3 months in there as well.
So do you think that healthcare in the province is starting to turn a corner?
I do. As I've said, the problem wasn't created overnight. It can't be fixed overnight. But we've been very engaged with the Registered Nurses Union, with NAPE, CUPE, Allied Health, with the NLMA, with the College of Physicians and Surgeons, and the College of Registered Nurses, our Pharmacist Association. By the way, I've hinted in there as well that we have scope of practice changes coming as well. So we've got a number of announcements coming in the near future, but those are things that are active in real time, and they are due to the consultation and engagement we've had with our stakeholders. We have a lot of work to do, but let me be clear, we've done a lot of work. We've seen our Category B sites, not every one of them, but most of them have seen a significant reduction in the amount of time that they've either gone to virtual care or that they've been the emergency departments have been closed. That has come with a great deal of work, and I want to commend the staff in our regional health authorities who've been absolutely dedicated at making this happen, and we've had staff in the department working overtime. They put in a great deal of effort. We cannot do this without the dedicated staff at both the department and in the health authorities. But we've seen tremendous progress in the last 2 months.
How much was that due to just the simple fact that some people were on vacation, and so now they're not on vacation?
I indicated in the summer that was part of the fact, but we've also increased, incentives to individuals. We've done a better job with scheduling in those areas. The fact that people were on vacation was a small part of it. In September, people are still on vacation. We've cut the numbers down to 20 or 25% of what they were in July and August.
Minister, can you just clarify the Category B sites, just for those that wouldn't understand what that term means?
So the Category B sites are the sites that are more rural sites. Bonavista, Harbour Breton, just to name a few. We've got there's a number of them throughout the province. But they're the sites that are a significant distance generally from an acute care site.
You mentioned earlier about 811, and there was a lot of information, so correct me if I have this wrong. You mentioned that there's going to be more staff with 811?
Yeah, so that's
Okay.
another new announcement, by the way,
Okay.
today.
Can you give me a sense of what the wait times became like? I know that it was being relied on a little bit more possibly during the pandemic. How stretched did that become, do you know?
Yeah, absolutely. So, we've got nurse practitioners through 811. The commitment from 811 was to have responses to individuals for a nurse practitioner appointment within 3 days. Because of, a shortage of family physicians, because of some emergency site or emergency departments closed, for a variety of reasons, that had grown to over 6 days, generally 6 or 7 days to get an appointment with a nurse practitioner. Because of that increase in time, we've added resources through 811 to bring that back to within 3 days. So there is additional nurse practitioner resources allocated to 811, and that will reduce the wait time for a nurse practitioner appointment to within 3 days again. So those positions are in the process of being hired, they're approved, they're funded, and within a very short period of time, I expect that we'll start seeing the improvement in wait times.
You touched on it in your speech there about newcomers to Canada that from the, in the medical field and getting their accreditation maybe I don't want to say sped through, but maybe cutting some of the red tape there. Can you speak to what you're doing in that regard?
Absolutely, and I want to thank both the College of Registered Nurses and the College of Physicians and Surgeons. They've worked very closely with us. They realize the shortage of health professionals globally and the fact that every jurisdiction in Canada is competing for those health professionals. They've reduced a number of the barriers to allow easier access for newcomers to the province to get employed. There were requirements in terms of courses. Those are now recommended, not required. For example, there are other changes that we are making with the College of Physicians and Surgeons and the College of Registered Nurses to make it easier for those individuals to gain access. And we've announced a number of those changes just a couple of weeks ago with both colleges. I think we'll have more to say in terms of the work we're doing with the colleges over the next couple of weeks as well. We've been very, very busy in the department, I can assure you, and both colleges have been very, very cooperative. It is complex because you want to ensure that the quality of service being provided through healthcare is not diminished by lowering the barriers. So we've worked very closely with them, and they've worked very closely with us to lower the barriers without impacting the quality of healthcare that individuals will receive. But there's been a number of changes in both colleges, and I think more to come.
We've been hearing about problems with people in this province being able to access primary care physicians for years at this point. But today in their annual report, Eastern Health released a new statistic that I think it's 21% of MCP registrants in that region don't have access to a family doctor, and that's compared to 12% last year, so that's almost double in just 1 year. Like, what does that kind of significant escalation say to you?
I think it's important to recognize that, I just as an example, I saw the National and CBC last night, and they indicated that they need 46,000 healthcare professionals. That's what they're short. Those are the vacancies in Ontario. They talked about a trauma centre in Ontario, which is a significant hospital, having 50% staff, having empty beds because they don't have enough staff. So the challenges that are faced are not just in Newfoundland and Labrador, they're in Ontario, they're in Atlantic Canada, they're in British Columbia. I speak to my colleagues across the country all the time. we haven't had our acute care centres with emergency room closures like we've seen in other provinces. Our health authorities have done a fantastic job in ensuring that our acute care centres didn't have emergency room closures. But what I will say is because of the global shortage of healthcare professionals, every jurisdiction in Canada is seeing an increase in the number of individuals that do not have access to a primary healthcare provider. And that is why, for example, we're looking at an increase in the scope of practice. That is why we've looked at incentives to ensure that our Category B sites have been cut to 20 or in some cases 25% of the emergency room closures over the last 2 to 3 months. That is why we are putting out the RFP for virtual care, because virtual care is a key to ensuring that, and the virtual care RFP will address if somebody doesn't have access to a primary care, a physician, a family doctor, the virtual care model will look after our family doctor shortage and ensure that those individuals, let me rephrase that, it won't look after the family doctor shortage, we're working on that, but the virtual care model will ensure that people without access to a family physician have access through virtual care. Ultimately, the goal is to get them a family physician. But in the meantime, the virtual care will ensure that they have access to a family physician virtually. It will also ensure that our emergency departments, if we have a scheduling issue or if there's a shortage of family physician or physician coverage in an emergency department, the virtual care RFP will look after ensuring that our emergency departments can stay open. So that's an important component to this. We've increased our efforts in terms of recruitment. I've indicated the Premier and Dr. Parfrey were in Ireland. We're continuing to work with Ireland, the UK, on recruitment efforts. Again, Minister Byrne, and I won't let the cat out of the bag, but there's a very dedicated recruitment process there. We are looking at a dedicated recruitment process, not only for registered nurses, but for LPNs in the province. The UK and Ireland is more focused on physicians, but we've got very dedicated recruitment processes that have started, and others that we will be announcing. All of these things are all building blocks in reducing the number of waits, ensuring people have access to a primary care provider, ensuring that our emergency departments are not closed.
More to the emergency department closures. At the AGM earlier, the interim CEO of Eastern Health was asked about what has been leading to some of those things, and he highlighted that they're seeing a lot more staff reassess and make new choices to accommodate their work-life balance, which he says is a completely new phenomenon that wasn't anticipated as what has been leading to some of the backlogs and delays at emergency departments. So can you just speak to that and sort of what has changed there?
If you look at, decades ago, you would have a physician working 70, 80, 90 hours a week. That came at a cost to family, it came at a cost to work-life balance. We don't expect our physicians to work that today. That it's no different than other occupations. But that is not unique to here. Physicians want and deserve work-life balance. They should have regular hours, if they're a family physician, or they should have, a work-life balance, and we support that. But that means that, you obviously need more physicians to ensure that people have access to a primary care provider. That is seen in every jurisdiction across the country. And we can't expect physicians to be, only dedicated to their practice. They have to be dedicated to family as well, and they have to look after their own health. So there is that work-life balance, and that is, I know Eastern Health said it's a new phenomenon, but, we support that, and it's to be expected.
Mr. Rivera said that was unexpected to see nurses go casual to get more control of their shifts. If we're asking nurses to regularly work 12-hour shifts and then overtime, not letting them go home at the end of their shifts, this has been an issue for years. Why didn't we expect some of this to happen? It doesn't seem all that unexpected that people are not going to want to work 150 hours a week.
I will say that, and I've said this a number of times, so this is not new news, by the way. We need to do a better job of recruitment. And we are starting to do a better job of recruitment. But we absolutely need to do a better job of recruitment in this province. That work is very strongly underway, and we will continue to improve how we recruit. But we need to do a better job of recruitment because our healthcare professionals have lifted a heavy load. That has been exacerbated because of things like the pandemic. But they've lifted a heavy load. And I have said it, I'll say it again, I'll continue saying we need more people working side by side with them to lift that load, to ease that burden. Otherwise, we face burnout. And, we are dedicated to not only improving the working conditions, but increasing the number of healthcare professionals working side by side with the healthcare professionals that are there. They have done a phenomenal job. They've carried the load, and I am very, very grateful for the work that they're doing. But to show that, we have to get more people working with them to lift the load that they've been lifting.
I wanted to ask about the increased incentives for physicians in rural emergency sites. Is that something that's going to continue now indefinitely?
We will do what we need to do to make sure that we reduce the number of diversions in our Category B sites. We will do what we need to do to recruit and to incentivize. We are absolutely focused on fixing the problem. And again, without creating false expectations, these problems didn't happen overnight. They won't be fixed overnight, but we have seen significant progress. And we are absolutely dedicated and focused on continued progress. We will not stop till we have the appropriate balance of healthcare workers in our system.
But the increased incentives that you said led to the reduced closures over the summer, are those going to continue, or are those being stopped now?
They will continue until we have the appropriate balance. We will do what we need to do to ensure that people have access to the healthcare they need.
You mentioned scheduling, maybe summer vacation responsibilities for one of the reasons why Category B sites are better staffed than they used to be this time 2 months ago. Was there a significant amount of people hired? Is that part of it? Like, is there any significant amount of people that have been hired into Category B sites so there's more there than there was when we last spoke?
It's a combination of a number of things. Summer vacation was part of it, no question. A large part of this has been the health authorities doing a good job of scheduling. A large part of it has been the incentives. I would say a large part of it has been the incentives. Part of it is recruitment, and we have seen recruitment improve. We will continue to see improvement in recruitment in this province. I can assure you, based on not only the incentives that we've put in place, incentives that we're looking at, not only the recruitment drives that have already taken place, but recruitment drives we are working on and will announce, we will see an improvement in recruitment in this province.
Yeah, sorry, Minister, I just wanted to make sure I'm totally clear. So the increased pay was set to end on October 31st. Is that still the plan, or is there a possibility of extension?
Like I said, we will do what we need to do to make sure that these sites, that individuals in these communities have access to the healthcare they need. So that's as clear as I can give it to you, but I guess you can read between the lines. We will ensure that we do what we need to have people with access to health care in those communities.
Good? All good? Thank you very much.
All right, thank you, everybody. And now